Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have Victoria Mondloch. She is a wellness expert with over 35 years of experience. She has authored two books. We'll be talking about those two books, and there are remaining two books in her series on hormone balancing. We'll be also talking about them. Welcome to the show, Victoria.
Thank you very much. I appreciate being here.
You are welcome. You are welcome to the show, Victoria. You are welcome to India in this online form. And I'm sure not just in India, but a lot of people will benefit across the world about what we are talking about. And as I said, a lot of people want this. Not only live 15 or 20 years younger, some people want to live forever. So uh, I'm sure you must be having some solution for that also. But as of now, we'll be talking about that. But before we come to this solution, let's talk about a bit about your journey, Victoria, so that people know who they are listening to.
Well, I'm a wellness doctor. My board certification is OBGYN. So, by definition, OBGYN is taking care of women through their menstrual career, through the times when they're having their families, and then after raising their families, they're now grandmothers. And they are many times the glue that holds the family and the community together. Yet many times we only pay attention to women in their family, making time of their life. And so as women go through the hormonal changes from puberty to menopause and then post menopause, what happens is we lose our female hormones. That's our lifeblood. That's our moxie. And we're told, oh, good for you, or you're past the storm, or, now you can enjoy life. But really, what would men do if their hormone was suddenly taken away from them? They would feel a lot of the same symptoms that women feel: hot flashes, migraines, deep fatigue, hair loss, weight gain, and things that really just don't want to fit in anybody's vocabulary. Nobody wants those things to happen to them. And you can exercise, you can change your diet, you can do all the things that medicine says you should do to get your health back, but you don't get your hormones back because ovaries stop working with menopause, which average age is about age 50 to 51. So, how can we feel younger? Well, it's not only about making sure that we put hormone back into our body. And I'm saying this deliberately because hormone is something that really is responsible for blood supply per square inch to tissues with hormone receptors. And estradiol, our main female hormone, that is exactly what it does. So with menopause, when you decrease then blood supply per square inch to tissues with hormone receptors, you decrease not just blood supply, but you decrease nutrition and you decrease the ability to pull toxin out of tissue. It's like only putting a small amount of food on your plate and then saying that, oh my goodness, that's all you get for your meal. And you're still hungry. Your body still wants more. Well, it's the same thing with not having enough female hormone in your system. And then, of course, you have to balance your female hormones, your estradiol and your progesterone. It's not about just putting estrogen in, or you will actually set your body up for estrogen dominance, which means you're setting it up for breast cancer, uterine cancer, ovarian cancer. So it's a fine balance, not just to put female hormone back and put it back at levels that are beneficial to you, but then balancing your female hormones with the other three hormone groups in your body. So those four hormone groups total are like four legs of a chair. If you sit on a chair with four strong legs, you feel secure sitting on that chair. If you have 4 hormone legs of your chair, of your health, and one leg is broken, you're sitting on a broken chair. Well, boom, you land on the floor. You don't even know how you landed on the floor. You're just on the floor. So you don't realize those hormones are out of balance. You go to your doctor, they don't know to check your hormone levels. So they check their baseline of labs and tell you everything looks good, but you still feel off. You still feel fatigued or hair loss or any of the other symptoms I was talking about. And they can't tell you what's wrong because they don't check your hormone levels. So doing not just your female hormones balanced, your female male hormones balanced, but the other 3 major hormone groups. So 4 total hormone groups, 4 legs of your chair. That's the foundation of your health. Keep those balanced and you will feel forever 15 to 20 years younger than your age. And what's wrong with that?
Right, Victoria. So if it's all about hormones, why are a lot, several doctors not uh, doing those tests and also recommending those things? Is it,
It's a
I mean,
great question, isn't it? Well, they don't even teach this in medical school. And the reason they don't teach it is because back in 1995, there was American versus European research that was done on menopause medicine and hormone replacement. And the premise was the same: put hormone back in your body for better health. But what was different about the research is what hormone was studied. So the Americans studied Premarin and Prem-Pro, neither of which are human-based. Premarin is pregnant mare's urine. Pregnant horse urine? Pregnant horse pee? Yep. And Prem-Pro is Premarin plus a synthetic medroxyprogesterone acetate, which, by the way, is the contraception shot. And in its insert for the shot, it tells you, it gives you an increased risk of infertility, increased risk of breast cancer. So that's what the Americans studied. The
right,
Europeans went, oh, no, no, no. We're going to use human-based bioidentical hormone, estradiol and progesterone. So both studies embarked on 10 years to see what they were going to find. And at 7 years, the Americans took a peek at their data. So in 2002, the Americans behind closed doors are looking at the preliminary data, and they wanted to see good results. So instead, with Premarin and Prem-Pro, they saw increased breast cancer, increased heart attack, increased stroke, and they went, oh, no, 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 no. Women, get off your hormone. The Europeans looked at the results and went, we don't see that. Well, we're going to keep going for the 10-year study, but they only did breast cancer. But they found a decrease in breast cancer.
okay,
Americans found an increase, opposite results, right? So the Americans said, you didn't do the heart attack and stroke data. So the Europeans did a 10-year study, again with estradiol and progesterone, did a 10-year study on heart attack and stroke, and guess what? Found a decrease in heart attack, decrease in stroke. And the Americans went, oh, shucks. Well, how come they're so different? Well, we'll take out the Provera, and then we'll do a study where we add estradiol. This is the Americans now. We'll add estradiol. We'll still keep Premarin in there, but we'll take out the Provera. They kept in the progesterone. So the Americans did a small study to see if they could get the same results the Europeans did. Guess what? Same results the Europeans did. decrease in breast cancer, decrease in heart attack, decrease in stroke, decrease in osteoporosis, decrease in Alzheimer's. Decrease in Alzheimer's. And the Americans went, well, now what do we do with this information? Shh. We just won't tell anybody. Because if we don't tell anybody, we don't look bad. And we're telling everybody for the past 15 years, hormone is bad for you. So let's just keep that message. Women are strong. They're resilient. They'll buck up. They'll be fine because they've made it so far without hormone. What? What? So medicine has deliberately undersold and given disinformation, bad information to women about their perimenopausal, menopausal health because they don't want to be embarrassed. I don't understand the logic here. But the European logic and research is crystal clear. You keep hormone in your system and you will actually decrease multiple things. As I mentioned, decrease breast cancer, decrease heart attack, decrease stroke, decrease osteoporosis, decrease Alzheimer's. Wow. And feel younger than your stated age. So we simply have to get the medical complex of how we teach medicine to doctors. We have to tell them, wait a minute, women's health is important. We need to put the science back into women's health. One study does not make policy, and that's what they've chosen to do, is let the Women's Health Initiative make policy for how they teach in medical schools.
Right, right, Victoria. So you mean Americans will, if they go to Europe, they can get that
They
thing.
can. Absolutely, they can. And the Europeans shake their heads at the Americans and go, I don't understand why they won't read our research and do what we do because we don't see their results. So women in Europe can get hormone. Women in the States are told you can maybe, if you have really, really, really bad menopause symptoms, we can put you on for a year. Maybe we can extend it, but no way are you on hormone to age 60 or past. Well, wait a minute. Then you're just pushing menopause back to age 60 and then you go through menopause all over again at 60. We should be able to have hormone in our body until we die. Because what women never are told is the science of menopause and hormone in women in menopause is that we become male. What? Our female hormone drops and our male hormone comes up. So we are literally more male than female. And what happens when that more male happens to us? Well, it changes our metabolism, number one. And we're a female metabolism, not a male metabolism. We gain belly fat. Belly fat is not what any woman wants or aspires to. So with that belly fat, our body will convert some of that fat, that estrone, which is a female hormone, which is in belly fat. It will convert some of that estrone to estradiol. Estradiol, but not nearly enough to protect you and your body for what you need protection from for all of your other symptoms. You'll still get hot flashes, night sweats, and migraines, and increased acid reflux, and all the symptoms that come with dropping your estradiol, but you don't make progesterone. So now you're making estradiol, but no progesterone, and now you're estrogen dominant, which in 15 to 20 years will give you breast cancer. Wait a minute. By doing nothing, by allowing natural menopause, you increase your risk of breast cancer simply because your belly fat will give you estrogen dominance, and nobody tells you that. Instead, what many American doctors do is they will put women on testosterone. Well,
Hmm.
we're already male. Why would you put more male in? Oh, for your libido. No, libido is estrogen dominant, not testosterone. So they throw more testosterone into women, which some of that testosterone converts to estradiol as well. So now we're more estrogen dominant and we feel like a guy with more belly fat. So we're accelerating our risk of breast cancer. There is no balancing of female hormone to male. And so it actually accelerates our risk of Alzheimer's as well. So it's just, where's the science? Nobody is looking at bioidentical hormone. And I did that research with my patients. And I did consented research, which meant my patients signed a consent for me to follow their hormone levels and then track them and graph them, not only for them, but as a population, not just for menopause. I started in adolescence. And so I did adolescent hormone levels. I did women in their 20s, in their 30s, in their 40s, 50, all the way to their 90s. And I developed the graphs to say, where should your hormone levels be for your age?
Right.
Wow. Wow. What a concept. Science in women's health. What a concept.
Right, Victoria. So, how should people look at, anti-aging, being young, feeling young, in terms of hormone? Should they look at only this part when they talk about hormone, or should they look at the wider sort of benefits that you just talked about?
They should look at all of it, because hormone by itself is going to be giving us back what our body naturally made. Think about the fact that menopause was not even a term that existed until about 1912 to 1920. Why? Because the average age of at least the American female in 1912 was 48 and a half years old. You didn't live into menopause. So menopause didn't exist. It wasn't an entity. With the advent of safe surgery and anesthesia and antibiotics and teaching people to wash their hands so you don't transfer bacteria between patients, there are some very basic things that happened in medicine that allowed lifespan to go up. But yet, when our lifespan went up in women, our bodies stopped making female hormone, and we were simply told, oh, it's normal. Just buck up. You can do this. You're strong, you women. But guys' hormone, they keep making it. And so guys never go through what women go through. So,
Right.
right. So, again, you need to understand the science. You need to understand that there are definite trends, definite age appropriate levels that our body will take us to. And unless you know where your personal levels are, how do you know if you're in balance? You don't know unless you do blood work to check. Salivary is not good enough, because this is what I say to patients who go, I did my saliva levels. I can do it from home. It's easy. Well, do you have saliva in your muscle? Do you have saliva in your brain? Do you have saliva in, different areas and parts and organs of your body? No, you have saliva in your mouth and in your GI tract. So is that representative of what's going on in your brain and muscle and joints? No. What is in every organ system in your body is blood. So the European studies and research is done with blood levels. The original American research was done with blood levels. So if we're going to compare research, European, and now do American research with trying to match and look at the same values that the Europeans had, we need to do the same type of blood research. In other words, do blood levels. And insurance will cover it. It simply needs to have correct coding put to it. It's as easy as asking your doctor for it. But in the States, only 23% of doctors are independent. The other 77% work for a hospital that's owned by an insurance company or by an entity that literally says, you cannot go there. I am your boss. I employ you, Dr. So-and-so, and I'm telling you, you cannot do hormone blood work on patients. Wait a minute. Why? Why can't we do blood levels on patients? Because patients bring money to the hospital system. And if we keep you 15 to 20 years younger, then you won't need as many tests. You won't need as many referrals to other doctors. You won't get cancer. You won't get Alzheimer's. You won't have heart attacks and stroke, and we don't make money. What? That's wrong. We're simply being told we can't do this testing on you because we need you sick. That's really what they're saying without saying it.
Right, right, Victoria. So, are the private clinics, those 23% who are into this, who own their own entities, are they going for hormone tests? Do you have any understanding on that?
You know, there isn't a lot written because the independent docs don't have really their own national network of practice. Like the AMA is supposed to be for all docs, but really what it is it's a political organization that makes, different protocols and policy, and they claim to be for all doctors, but there's very little that is done to differentiate between the employed physician over here who works for a hospital and the independent physician over here. So it's up to the patient to find the independent doctor who will then write for blood work and then write prescriptions for hormone. So, but
Right.
again, if they didn't train that way in medical school, they may not be open to prescribing hormone, even if they can prescribe hormone.
Right, right, Victoria. Nowadays, there is a lot of talk about, functional medicine, functional food, and, food as medicine. And
Correct.
people are looking at that as the first solution in many, many cases. How does that sound to you, especially if someone starts having the right kind of food that can do some fulfillment for those hormones later in life? Or, it's not that they will only look at, say, age 40 or something. But suppose if someone starts having the right kind of food at 40, how do you see uh, the the shortfall of hormones covering up by these things?
Well, food is very, very powerful. Your lifestyle, exercise, very, very powerful in controlling your metabolism, the speed at which your body works, in controlling the different balance of whether or not you have more belly fat. But think of the fact if you wait until you're 40 to start, you've missed probably 20 to 25 years of doing it right before you get to 40. So, perimenopause, when you start getting hormone swings, if you wait to 40, then you've lost 20 to 25 years already of properly balancing and training your body to do it right. And so my recommendation when I see my patients is that as soon as I meet them, if I meet you and you're 15 years old If I meet you and you are 30 years old, if I meet you and you're 45 or 50, it doesn't matter what age, the advice is the same, but the earlier you start it, the better. So yes, proper diet and exercise is huge. Keeping your belly fat off, keeping a good body mass index, a BMI of less than 25, or at least between 25 and 30, and you're going to have less severe symptoms if you put more vegetables, less meat in your system. You're going to actually have a better time in your menopause transition. Foods that have estradiol in them naturally are soy, but a good quality of soy, and in the small amounts of soy, because you need some, but not a lot. But in progesterone, the food that carries natural progesterone is yams. And yams, you have to have a lot, and you have to have several servings daily to balance any estradiol or soy that you eat. Balanced diet is always going to be better. Cut the sugar, because sugar, man-made sugar, feeds cancer. We don't want to feed any cancers. And if you already have an estrogen dominance, you have a higher tendency for cancer. So don't give it sugar on top of it. Exercise, huge, again, for controlling not just your metabolism, the speed at which your body works, but also to keep your belly fat down. Keeping belly fat down, you're going to decrease that estrone, which will convert on its own to estradiol, which you have to counter with progesterone, which is your yams. So yes, you can use diet and exercise to help with hot flashes and hormonal symptoms, because you're also keeping your blood pressure down, you're keeping your body mass index down, you're decreasing a risk of diabetes, and that's just going to be a healthier lifestyle overall. So yes, lifestyle, diet, and exercise is hugely important, but paying attention to where your female hormones are as one leg of your four-legged hormone chair. That's one leg. Your thyroid as another hormone is another chair in your hormone, or another leg in your hormone chair. Your third leg is your stress, your cortisol. Well, who has stress, right? We all have stress, whether it's physical stress, whether it's emotional stress, financial stress. We all have stress. And the fourth hormone is your insulin, not the blood sugar, the insulin. So you need to know where your female, male, your thyroid, your cortisol, and your insulin are. And you balance those four hormone groups. That's the foundation of your health. You balance those throughout your life, and you feel 15 to 20 years younger forever. What's wrong with that? Nothing.
Right. Right, Victoria. There is much to learn from you. There is much to learn from not only this episode, but also from your two books that are already out and two are remaining. Tell us a bit about your books. Who is it that for, especially the ones that are out, and how can they use that book?
Well, and thank you for that. Being an OBGYN, I first focused on women's health. Then I started seeing men as well. So I have 4 books total in my series that I want to write. So my first book, Blossoming, is all about the adolescent female. And we all know an adolescent female with hormone imbalance. And it's written as a mother-daughter guide, because moms need to be there as part of helping their daughter make the right decisions. They're not able to make health decisions yet, they're not adults. So, but yet they're going to go through a lot of physical changes that they don't understand. And they may have symptoms that are very different in hormone symptoms, like hot flashes. Even as an adolescent, they may have migraines, they may have very heavy flow, very heavy bleeding. and their best friend may not. And what's the difference, they ask. And their doctor simply says to them, well, I don't know, but I'm going to put you on the pill. Well, wait a minute. No, I want an answer. Why do I have more symptoms than my friend? Well, I don't know, but we're just going to put you on the pill. And when you're ready, or if you get bad enough cramps, then we might have to do surgery. Well, no, nobody wants surgery and nobody wants to be covered up with pills. They want answers. They want a root cause as to why is my body doing this. But medicine won't go there. The second book that I wrote is for the perimenopause, menopause, postmenopause woman. And in both books, what I do is I talk about and dispel the myths. I tell the truths about what information they're being told. What is the disinformation that medicine is giving you? What is really going on in your body? And then if you know the truths, then let me show you where your numbers should be for your age. Let me give you the rationale behind the symptoms you're having. Let me tell you about the American versus the European research. Let me do case studies for you. And they're real life patients of mine that I changed their names, but the stories are the same. What is really happening in real life with patients? And then at the very, very end is a chapter in both books, how to talk to your doctor. What are the labs you want your doctor to draw? Why? And if your doctor, know that if your doctor won't order them, that you, at least in the States, you can order your own blood work. Most
Right.
people think they need to have their doctor order it. Well, you can order it yourself. You'll have to pay for it, but if you have a benefit with your health insurance, like a health savings account or a what they call an FSA, which is, I forget what the F is, but it's another savings account where you can take personal health related payments that you've made and get reimbursed from this fund. And you can use that fund to pay for the labs that you want done. So you can get your hormone levels drawn yourself and then take those numbers to your doctor. And if it's one of these 77% of docs that works for a hospital or an insurance company, they can't interpret them for you because they're told you can't go there. So now you have to find a doctor, an independent doctor, who will go over these lab values with you and tell you what they mean. But my books will tell you that too. So I have the graphs in the books of where your hormone levels need to be for your age.
Right. Right. Right, Victoria. Great. I'm sure a lot of people would learn a lot from this episode and also would want to understand more from you directly, more about you. And that is where, take your help directly. So, what is the best way for them to connect with you?
The best way is by email. And I'm perfectly fine with people emailing me. It's my first initial last name. So VMONDLOCH at gmail.com. My books are on Amazon, and my website is the whole https/dr Victoria J Mondloch.com. So
Wonderful.
again, the website is Victoria or drvictoriajmondloch.com.
Wonderful. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.